So as part of the clinic appointment today, Michael, I've asked you about your symptoms. I'm really glad to hear that you're starting to feel a lot better from when I saw you about 4 weeks ago. What I'd like to do now is repeat the pheno test that you'll remember that we did last time you came to clinic. So just as a reminder, this is a quick, simple, easy test to do, and what it's going to give me is a number or a measurement to tell me about the inflammation in your airways. So we had quite a high reading last time. What we're going to do this time is make a comparison and see if it's come down to a lower level, and that'll tell us whether or not the steroid inhaler that you've been on has actually been of some benefit to you.
Okay, yeah, great.
So, as you can remember from last time, there are 3 parts to the test, and I will talk you through it as we're going through. First thing I'm going to ask you to do is completely empty your lungs. You're then going to put the mouthpiece in your mouth, breathe all the way in, and then blow out slowly and steadily for 10 seconds, and then the machine will count down and we'll get that number at the end.
Okay, great, yeah.
So just as a reminder, I'm going to show you what you will actually see on the screen while you're doing that breath out. So you've got the gauge here, the needle is moving, and you can see that it's moving in the green band, and that's exactly where we want it to stay. So during the breath out, if you blow too gently or too forcibly, the test will stop and we can just have another go. That's absolutely fine.
Okay.
But the aim is to keep it in the green band. Right, so we've put a nice clean mouthpiece on the top for you. And I'm going to pass you the breathing handle.
Thank you.
So as I say, 3 easy steps. First thing you're going to do is breathe all the way out and then pop that in your mouth for me. That's good. Breathe all the way in. You can see the orange lights lighting up along the bottom. Once you feel your lungs are full, that's it, start to blow out. That's absolutely perfect. Keep that blowing nice and steadily. We're over halfway now. Couple more seconds. That's absolutely brilliant. Well done. Thank you. So we'll just pop that in and we can see the countdown there. So I just want to recap. When you came to see me a few weeks ago, you had quite a lot of asthma symptoms.
Yeah.
So could you just run through those with me again, the sort of things you were experiencing?
Coughing, wheezing, sometimes waking up at night as well.
That's right, that's right.
Yeah.
And you had a blue inhaler at that time, didn't you?
Yeah.
Just a blue one, and you were using that quite a lot.
Yeah, quite a lot.
So when I saw you 4 weeks ago, and your pheno level was high, we started you on an inhaled steroid.
Yeah.
So how often have you been taking that one?
Every morning and every evening.
Fantastic.
Yeah.
So that's been two doses in the morning and 2 doses at night.
Yeah.
So in the past couple of weeks since you've been taking that, have you needed to use the blue one at all?
No, not at all.
Oh, that's
so
good.
feeling a lot better actually.
And what about the coughing and the wheezing?
It's definitely reduced, a lot. So it's definitely feeling a lot better.
Good.
So,
and any waking at night?
No, it's all gone.
All good news?
Yeah.
So the countdown is coming to an end now, so we'll see what your result is today. Well, there you go. That's 18 today, so that's absolutely fantastic. What that does is reassures me, and I hope you as well, that steroid inhaler has worked. Your symptoms have reduced, and we've also got that value and that measurement to show us that the inflammation has reduced. So you're now at a nice low level in the green section there. So
perfect.
Well
that's
done.
great. That's
so
great.
We need to carry on with what you're doing, and then I'll review you again in a couple of months' time.
Perfect. Sounds great. Thank you.
Thank you.
Cheers.